Hello, and welcome to New Hire Orientation. My name is Lisa Pfeiffer, and I am the Compliance and Privacy Officer for Santa Clara Valley Medical Center, O'Connor Hospital, and St. Louis Regional Hospital. Today we're going to go over our compliance program and talk to you a little bit about compliance and HIPAA patient privacy. We're going to start with our compliance program overview. Compliance is a program that is recommended by the Office of Inspector General, which is the auditing arm of the federal government. They recommend that every healthcare provider and entity have a compliance program to help prevent, detect, and resolve any potential compliance or privacy concerns. Some examples are billing for services that were never performed, inappropriate documentation, and inappropriate coding. We have a compliance program at the Health and Hospital System with the 7 core elements recommended by the Office of Inspector General. Element number 1 is to have policies and procedures and a code of conduct. You will all receive a copy of our code of conduct when you log into HealthStream, which is our e-learning platform. You are required to read through that code of conduct and attest that you are going to abide by it. Element number 2 is to have a compliance officer and a compliance committee. These 2 entities help to direct the compliance functions of the health and hospital system. Element number 3 is to have regular education and training of our staff. This is your first introduction to compliance and privacy training as part of the County of Santa Clara Health System. We also do regular education and training through the HealthStream learning system and through monthly emails and alerts that we send to staff. Element number 4 is to have a process to report concerns. We want to make sure that our staff feel comfortable reporting any of their questions or concerns to us and know that we will take them very seriously and we will investigate every concern that comes to us. And we'll talk a little bit later how you can report those concerns to us. Element number 5 is to have regular auditing and monitoring. In our annual work plan for compliance, we develop what areas we're going to auditor and monitor that year, and we make sure that we work with the different departments so that we can have a robust auditing and monitoring program. Element number 6 is to have a process to investigate and correct any potential inappropriate conduct. So we know that we're not perfect and we're going to find problems in our system. When we find those issues, we identify them immediately, we get them corrected as fast as we can, and then we implement corrective actions, which can include repaying some of our payers if we were paid inappropriately, correcting our policies and procedures, and re-educating staff. The last element is number 7, have a disciplinary process for staff. So if any of our staff violate our code of conduct or our policies and procedures, they can face disciplinary action up to and including termination. We're now going to move on to our HIPAA patient privacy section. HIPAA stands for the Health Insurance Portability and Accountability Act, and HIPAA helps us to protect our patients' privacy. We are required to protect patient privacy both in an electronic form, such as our EMR, electronic medical record, and in paper form. So the HIPAA rules dictate how we have to protect patient privacy in both of those formats. In addition, HIPAA defines what minimum necessary and reasonable safeguard standards are, and we'll be going through those during this presentation today. I want to just point out here that today we're going to be going over the general HIPAA privacy laws, but there are other California and federal laws that impact the patients that are seen at our system. There are laws for mental health patients, which is Welfare and Institutions Code 5328, which provide higher protections for our mental health patients. There's also the federal 42 CFR Part 2 law that provides extra protection for our patients that are receiving substance use treatment services, as well as HIV and AIDS testing laws and minor confidentiality laws. Minor confidentiality is a law that says that children as young as 12 can consent to certain procedures without parent permission. We're not going to be going through these laws in detail today, so if you need additional information about these laws, please make sure that you talk to your manager or supervisor, or you can reach out to our office and we'll be happy to give you that information. Now we're going to talk about what patient health information is. So protected health information is anything that's verbal, written, recorded, or electronic that talks about 2 elements about a patient. Number 1, it talks about their past, present, or future medical or mental health condition. And secondly, it has a way to identify the patient. So there are 18 different identifiers under HIPAA. I listed a few of them on the slide for you here. Name, address, phone number are considered identifiers. Medical record number, social security number, even vehicle license plate is considered an identifier, although that's not something that we collect in our system. And of course, photographs. So when you talk about protected health information or PHI, we're talking about both of these elements. So I want to give you a couple examples. If a patient presents at one of our clinics, they're going to get registered and receive a wristband. On that wristband is going to be their name, date of birth, their gender, CSN, which is an account number, medical record number, and potentially a three-digit location that describes where they're receiving services. If that wristband is put on the wrong patient, that's something that we want to be reported to our office, but in most cases that would not be a reportable privacy breach because element number 1 is missing from the wristband. On the wristband is going to be nothing about what your medical condition is or why you're being seen at the clinic that day. It's solely for identification purposes. Now, the second example is an after visit summary. We also call this an AVS. On this document, you have the same elements as what I described on the wristband, but it will also talk about future appointments, medications, and why you saw the provider that day. If that document is handed to the wrong patient, then that's absolutely a potentially reportable privacy incident because there is medical information on that document and there is patient identifiers on that document. So I hope that helps to clarify what PHI is and what we're looking out for. We want our staff to report both incidents to us, just the wristband being put on the wrong patient and the AVS being put on the wrong patient, and our office will determine which ones need to be reported to our federal or our state regulators. Okay. Next slide is talking about using and disclosing PHI. So healthcare providers are allowed to use and disclose PHI for 3 main purposes: treatment, payment, and healthcare operations. So some examples of treatment is when a provider needs to access the patient's medical record in order to be able to treat the patient, or a nurse needs to access the medical record so they can provide a medication or an injection to the patient. Those are some examples of treatment, and it's perfectly fine for our staff to access the record for those reasons. Under payment, some examples are running an eligibility hit to find out what kind of insurance the patient has, or finding out what their copays or deductibles are. In addition, our billing office staff are allowed to provide copies of the medical records to the payer so that we can get paid for services that we've rendered to the patient. Those are acceptable accesses to the medical record for payment services, and we do not need patient permission for that. Number 3 is healthcare operations. Some examples of healthcare operations are our quality teams that are doing quality reviews of patient medical records to ensure that our staff are providing good quality care and documenting it appropriately in the medical record. Another example is my office performing our routine auditing and monitoring to make sure that we're meeting all of the different compliance standards. So we're allowed to access patient records for that reason as well. And we do not have to have patient permission for that. Anytime that an access or disclosure falls outside of these 3 elements, however, we need to have the patient's permission, and we have an authorization form that the patient can fill out to provide us that permission. Now, I want to talk to you about minimum necessary standard. The HIPAA law defines what minimum necessary is. And basically it says that PHI must be limited to the minimum amount we need to perform our job duties. So if I'm a registration clerk in the clinic, for example, and a patient presents to me to be registered for care, I'm going to register that patient, but I probably have no reason to be looking in that patient's chart going back several years. All I need to access is what I need to register the patient for that particular visit. Similarly, my staff, when they're performing compliance audits, we usually are auditing something that's very specific, and so we have specific areas in the chart that we're looking at, and we don't need to be looking in other areas of the chart that are not relevant to the audit that we're performing at that time. Next is reasonable safeguard standards. So the law also tells us that we have to take reasonable safeguards to protect PHI. And there's 3 different types of reasonable safeguards. The first one is administrative safeguards. Those are our policies and procedures around HIPAA and when staff are allowed to access medical records and when they cannot access medical records. In addition, we have about 30 different policies and procedures around HIPAA, so as you get more familiar with our system, want to make sure that you go onto our website and check out those policies. And I'll show you where to find those in a few minutes. The next example of a reasonable safeguard are technical safeguards. So those are ways through technology that we can protect our patient's privacy. So for example, email encryption. Whenever we're emailing PHI outside of our system to another entity, for example, Stanford or Gardner, because we're coordinating care, we need to make sure that that email is encrypted. In order to do that, we put SCC Secure in the subject line of that email. What happens is the recipient on the other end gets an email that says you have an encrypted email. They log in, create a username and password, and then they can read that email. And then the PHI is safe as it travels from our servers to the other entity's servers. Another technical example is locking your workstations when you walk away from your desk. So if you're going to a meeting, you're going out to lunch, you need to make sure that you lock your workstation so that no one can access the PHI on your workstation. Lastly, a physical safeguard. So physical safeguards are ways that we protect paper PHI. So for example, if you have paper records or confidential documents in your office, you want to make sure they're in a locked cabinet and then you lock your door as you leave. Another example is our badges. Our badges will let us into certain areas where we're supposed to be and keep us out of areas that we're not supposed to be in. Okay, next I want to talk about is Fair Warning. Fair Warning is a system that we purchased several years ago that helps us to monitor staff access to patient medical records. Fair Warning pulls in audit trails from HealthLink, which is our electronic health record. And I know that not all of the new hospitals are up on Epic at this moment, but you will be up on Epic in the coming months. So we want to make sure that you understand what Fair Warning does. So we will pull in the audit trails from HealthLink that shows every single touch that an employee makes in a patient medical record. We pull in information from PeopleSoft, which is our human resources system. So I will know your name, your address, the department that you work in, and who your manager is, and of course your job title. And then we also pull in information from Active Directory, which is our computer logon system. All of this data then feeds into the system, and we can run different alerts based on the information. So these are an example of some of the alerts that we have available in Fair Warning. The first one that we turned on was self-exam. Self-exam would be me logging into HealthLink but pulling up my own patient medical record in the system. So I'm doing a self-exam of my own medical record. It is against county policy for staff to pull up their own medical record in the system. We have to have a business reason to need to be in a patient's medical record. And if you're a patient of our system, you have no reason to be in your record as an employee. You would be taken care of by other staff if you came here for patient care. So we do not allow our staff to access their own medical record for any reason. The second alert that we turned on was household snooping. Household snooping would be me logging into my husband or my son's medical record. So what we're looking for in this alert is the patient address matches our employee address. When those two match, it sends up an alert that there could be a potential household snooping. What my staff does then is review that case to find out what was the employee's job roles, was the patient being seen where the employee had to somehow take care of them. So for example, if you're a registration clerk in one of our clinics and a patient comes in for care that just happens to be your family member, if you're the only registration clerk available, then it's part of your business duties to register that patient, and that would be an appropriate access of their medical record. However, if your loved one came into the hospital, but you work at an outpatient clinic and never float to the hospital, then there's a potential that you're snooping through their record, and we would then have to investigate that further. The next alert that we turned on was coworker snooping. So coworker snooping, we're looking at it for coworkers within the same department. So for an example, a pharmacy staff member looking at the patient record of another pharmacy staff member. That would trigger a coworker snooping alert. Similar to household snooping, we would take a look at why was that employee in that coworker's record to see if it was business related. If it's business related, we're going to close that alert out. What we're looking for are staff snooping through patient records inappropriately. And the fourth one, we turned on was manager snooping. So what we're looking at here are managers looking into their employees' patient records and employees looking at their managers' patient records. There are other alerts on the slide that we have not turned on yet, but we will be turning them on this year. So we just want to make sure that all staff understand that we are monitoring staff access to patient medical records, so please only access patient charts when you have a business reason to be in the medical record. Now we're going to go through some tips for avoiding a breach. So the first tip is access PHI only when you need to do so to perform your job duties. There's really no other reason that staff should be in patient medical records unless it's related to their job duties. Make sure that you are not taking PHI out of the building. If you need to take PHI home for some reason, you need to make sure that you have manager's permission and it needs to be properly safeguarded. Most staff can have access to the remote access system if that's appropriate for your job role, so it's very rare that we ever need to take paper records out of the system any longer. Make sure when you email information outside of the system that you use SCC Secure. It's highlighted in red on the slide for you. That encrypts the email when it's going from our server to the outside server, and it's required under the HIPAA security rule. In addition, most of our breaches are still paper that are being sent to the wrong place. So that's a wrong fax number being entered in, or staff handing patients paper without verifying who they're handing the records to. Make sure that you just slow down and take time to verify 2 patient identifiers. So this is Mr. Jones, this is his medical record number, this is his paperwork before you hand it out. In addition, when you're faxing something, just double check that you've keyed in the correct fax number before you hit send. Lastly, make sure that if you receive a laptop or a jump drive or flash drive from work for work purposes, that is encrypted. If that media device is not encrypted and it's lost, it's a potential privacy breach. And all of those patients' information is potentially at risk. Okay, so now we're going to talk about some penalties and notification requirements that we have. So as a health and hospital system, we are required to report our breaches to the federal government. And the federal government can then come out and investigate those breaches, and they can also fine us. The maximum fine that we can face under the federal law is $1.5 million per incident. We are required to notify the patients within 60 days of the incident happening, and we must notify the federal government at least on an annual basis of all of the potential breaches that we've had. In addition, this law is where the media notification comes in. So if we have a breach of more than 500 patients, we also have to notify a prominent media outlet. And the reason for that is because the government wants to make sure that the message gets out to all of those patients whose information was breached. Now, the hospitals have to deal also with the California law. So there's a requirement that we report to the California Department of Public Health any potential privacy breach that's happened in our facilities within 15 business days. They can fine us a maximum penalty of $250,000 per incident, and we are required to notify both the patient and CDPH within that 15 business day deadline. So as a system, we require our employees to notify us of any potential privacy breaches immediately so that we have time to investigate and get these reports made on a timely basis. There's also a California law that says you as individual employees can be penalized for privacy breaches. So you can face fines of up to $250,000. You can be charged with a misdemeanor. Patients can sue you for damages. If you are licensed or certified, you can get reported to your boards, who would then investigate and discipline you, and then we have the county disciplinary process. The county disciplinary process can be found in Policy 585.22. There's a slide at the end that lays out the different levels of discipline based on the type of breach that happened. So it's really important that our employees understand that the penalties are not just for us as an institution, but can also be for you as individual employees. Please make sure that you're only accessing patient medical records when you have a business reason to be in those records. This is a link to our Ethics and Compliance Program website. So we have a lot of good information out on this website, including how you can reach us if you need to report a concern. We have a link to both our compliance and our HIPAA policies, and also training documents out on this site. I strongly encourage all of you to make sure that you come out here and take a look at the site whenever you have time. So I wanted to make sure that you guys understand how you can report concerns to us. So we have several different ways you can report things to us. We have an email box, complianceofficer@hhs.scc.gov.org. So you can email us your questions or concerns, and we will research them and get back to you. You can also call us on our main number. That number is answered by one of our staff from 8 to 5 business days. We also have an anonymous hotline. The hotline number is answered by a vendor that has nothing to do with our system, so they're not going to know who you are, and you can feel comfortable leaving as much detail as you have regarding the concern that you're reporting. They then send us a message that there's a new concern, we can investigate it, and then hopefully resolve that concern. So it's important that our staff know that you can remain anonymous by calling that anonymous hotline. You do not have to give your name or the department that you work in, and we will be able to still investigate your concern and get back to you. So we want to make sure that staff understand that we are here to help you. We are here to help you understand the different rules and regulations that govern the service areas that you're working in. Also how to apply the different rules and regulations to your everyday work practices. So please feel free to contact us anytime you have questions or concerns. And we want to welcome you all to Santa Clara Valley Health and Hospital System. Thank you.